blood pressure. You know, there are several trials, yoga exercise and other meditation that have shown to reduce blood pressure. There is impact on other habits. So you do not smoke in the daytime, so that's the positive side. You also, it may affect your exercise. However, there's no single trial to show that exercise is a problem during fasting. Actually, we should promote and encourage exercise, particularly early on the day with fasting. There is a problem in our practice of fasting because of the good habit of family gathering, but that actually changed from family gathering to overfeeding. And this is very important habit. So, you know, when we gather together, we should not really overeat. Similar to what happened in most of the conferences. You have like 5 meals and you don't move at all. However, there are differences in hypertension and fasting. And this differs from one country to another because there is difference in the time. You know, some countries fast 6 hours. You do not even feel the fasting. There are countries that fast 21 hours. There is different in the weather and season, whether it's a cold season or hot season, and the nature of work, whether you're like a professional working indoors, similar to most of us, or you are working, you know, labor working on the road in the summertime. Work regulation and working hour, and also, as I said, nature of work. And habits make a huge difference, whether you break your fast with excessive carbohydrate and salt, or you break your breakfast with you know, a dash like diet. So clinical studies, several studies, you know, I have counted more than 15 studies. At least 11 or 12 of them were mentioned in our chapter in SHMS, chapter 17. They are small size. They compare blood pressure before fasting, during fasting, and after fasting. And vast majority of them would either show there is a small benefit or there is no benefit. And there's no study yet published in the literature to show that fasting is harmful. So this is a study from Turkey, and they compare intermittent fasting effect on blood pressure variability, and they have 60 patients. Blood pressure was measured in the office, home, ambulatory blood pressure, and they have seen significant drop in systolic blood pressure from 122 to 116, but that's the only parameter that improved. The other parameter did not improve. The ambulatory, the home, the you know, other reading did not really improve. And they also noticed, which is important, you know, a drop in urinary sodium. We nephrologists think that this is a very excellent, actually, you know, a parameter to look at in the dietary salt intake. Again, as you can see, that the systolic blood pressure dropped from 122 to 116. This is another study also that showed there is minor drop of systolic and diastolic from 131 to 128. We looked into this in our patient in King Faisal Specialist Hospital in kidney transplant. We probably did the largest study in the literature, around 1,000 patients. Some fasted and some did not fast. And we assessed the blood pressure, creatinine, lipid, hemoglobin A1C, weight. And as you can see, 1,011 patients, and ultimately around 280 in each arm. And we looked into all the parameters based on age, period, presence of diabetes, hypertension, baseline creatinine. In all of them, there was no difference. So the question we had, you know, the question we had, why did we get no difference? And basically because I think most of our population break their fast with very unhealthy food. No one of us resists taking luqaymat after the breakfast. Most of the diet is high in salt, high in sugar, and high in lipid. And very few of our patients break their fast with fruits and vegetables. And before I conclude the topic, I want to show you a very fascinating recent report on impact of fasting on diabetes mellitus. And this is a 3 case reports from Toronto. Age between 40 to 67, and they had diabetes mellitus type 2 for a prolonged period of time, up to 25 years. And most of them were on multiple anti-diabetic agents, insulin and oral hypoglycemic agent. And look, with fasting alone, medical supervised fasting, they were able to get rid of all anti-diabetic agents. And they could able to do this, as fast as 5 days. 5 days of fasting, and then when they break their fast, they break the fast with a medically, advised diet. So something rich in fruits, something rich in vegetable, rich in fluid, but deprived of salt, animal product, and others. And you look, they came out of their insulin, they came out of their anti-diabetic agent, and they lost weight. They have lowered their waist circumference. And this is why we're not getting the good result. So the message I want to conclude here before, an important issue is during fast, one should have adequate water intake. And الحديث النبوي الشريف ثلث لطعامك ثلث لشرابك وثلث لنفسك. And unfortunately we took probably 2/3 and a half to food and then the limited half of the third distributed on the other things. So we do have missed opportunity, and I think we medical professionals have an opportunity to improve in diabetes, hypertension, obesity. If you go anywhere in Riyadh, in Jeddah, ask people not to eat or not to smoke, they will not, respond to you. But if you tell them fast, they will stop smoking, they will stop overeating, etc., etc. So using, I know it's an indirect way, but using religion and getting people health is, I think, a very smart way from us to do. So fasting does probably reduce blood pressure, weight, lipid, and glucose metabolism. And physicians should work with patients during Ramadan to achieve these goals. And this would only happen if we sit with the patient and give them a prescribed, medically supervised way of losing weight and fasting. And we should not tell patients do not fast. We should actually encourage patients to fast. During Ramadan, we should encourage patients to fast, on Monday, Thursday, or every other day. However, when they break their fast, they should break their fasting in a very supervised way. The diet rich in fruits and vegetable. With that, I conclude the fasting. And I would conclude it with what SHMS, the expert, guideline, have concluded. Hypertensive patients are encouraged to seek medical advice before fasting, and majority of people can fast. Patient with uncontrolled blood pressure, they should get their blood pressure controlled before fasting. And patient education should emphasize on need to maintain compliance to medication. Patient should have adequate fluid. And once daily dose or maximum twice daily dose medication is recommended rather than Q6 and 8 hours. With that, we'll conclude the fasting chapter and we'll go to Hajj chapter. And, we know that Hajj is also a part of, Arkan al-Islam. And in Hajj, it has physical, it has emotional, and it's a very important journey in life of most of Muslims. Last year, we know that 2.4 million performed Hajj, 74% from outside the kingdom, and they have universal health insurance the minute they enter the kingdom. And this is, important effort from the Ministry of Health. Almost 500,000 outpatient visit, 43,000 emergency visit. And if we go to hypertension, the data on hypertension are really lacking. And this is a very good area for research. If you are from here or if you are interested, I think this is really a good area of research. We could see that causes of admission, you can look here that most of reason for admission have some relationship with hypertension. Whether it is in the top, cardiovascular, 63%, myocardial infarction, angina, hypertension. Most of these are either directly or indirectly related to hypertension. If we look at hypertension prevalence in people performing Hajj, it would be probably similar to hypertension in general population adult, which is around 1/3 or 1/4 to 1/3, 26%. And the journey definitely has some exhaustion, exercise, people get tired, sleep disturbed. And what we could recommend, and from this, you could see that 60 patients died because of hypertensive crisis, 30% died with cardiovascular event, and significant number underwent cardiac cath. So blood pressure control and medication adherence and monitoring are really lacking because there's no good data. What we could clearly recommend that any patient can perform Hajj, provided that they have been medically checked at least 2 months before going to Hajj. 2, they need to increase adherence and monitoring of their blood pressure and their blood pressure medication. They need to perform exercise before going to Hajj journey, because most of people get exhausted during Hajj. And if they perform exercise and training before coming, that would reduce the morbidity and mortality in Hajj. So what final message to SHMS recommend? They say hypertensive pilgrims should have medical checkup before they leave home for Hajj, particularly elderly. Patients with severe hypertension should achieve blood pressure control before starting Hajj. Once daily medication regimen are preferable. Adequate fluid intake is generally recommended. Keeping blood pressure control and adherence to medication and checking blood pressure regularly would definitely reduce the morbidity during Hajj. With that, I really thank you for staying and thank you for listening.